Thanks for joining us for our Chamber Connection podcast. Thanks to our friends at Speakeasy, we are here for the next 52 weeks, bringing you guests from around our community, elected officials, business owners, folks doing great work here in Macomb County. So sit back, take a listen, and we hope you'll join us every week for our Chamber Connection. Thank you for joining us for this edition of the Chamber Connection. I'm Stacy Ziarko, President and CEO of the Sterling Heights Regional Chamber of Commerce. We're grateful to be back here at our Speakeasy Studios in Sterling Heights, and my guest today is Maureen Rovas from the American Lung Association of Michigan. Maureen, thanks for joining me today.
Thank you for having me out.
So many of you know me well, that nonprofit and our nonprofit organizations hold a very special place in my heart. So I'm excited to have Maureen here today to tell us a little bit about what the American Lung Association does, how you've changed over the last couple of years, because you certainly have. So, tell us a little bit about yourself, and then tell us a little bit about the American Lung Association.
Great. Well, thanks for having us, Stacy. And we're fortunate to be an active member in the Chamber and very thankful for Chambers of Commerce who support nonprofits. Absolutely. It's a vital way for us to be out in the community. So thank you always for championing our work.
Absolutely.
I know it's close to home. We love it. But as you mentioned, I serve as the Executive Director for the American Lung Association here in Michigan. And it's a wonderful opportunity for me to take my passion for being out in the community and helping to empower our community to make an impact on lung disease and healthy air, and a chance for us to spread our work along with our constituents across Michigan for those that are impacted by lung disease and those that are just breathing air on a regular basis. So our work really crosses many barriers.
So what are some of the areas of focus that the American Lung Association has?
Yeah, many think of us first and foremost for traditional lung disease, maybe those who may have COPD or pulmonary fibrosis. Often individuals think of us for asthma, those that are impacted, and of course lung cancer. We think anything with the lungs. And of course, like many organizations, when COVID-19 came around, it is a respiratory disease, and so that does fall under our program of work. So everything related to the lung, we really come at it in kind of three parts. So first and foremost is just really being that reliable source of information for everybody who's looking for information around lung disease, so that trusted champion of lung health. But we're also here to look at research and making sure that we're funding that. So, of course, on the prevention side, as well as treatment, quality of life, we're here to provide information and programs and services for those that are impacted by lung disease, who may need support, who might need a support network, might have questions. Maybe they're trying to quit tobacco use. Sure. We're here for them. And we're around for that. And of course, advocating for everybody. So all Americans are touched by our work across the U.S.
So what are some support services that you do offer? Mainly, maybe it's for someone with asthma or someone trying to quit smoking. What are some resources available to them?
Yeah, we have some incredible programs that I love that you asked, because I think we have some tried and true that are really great. So you think about tobacco. I love our approach. It's not going to shame anybody. We're here when somebody's ready to quit. We have some incredible programs. Our signature is our Freedom from Smoking program. So you can call into our 1-800-LUNG-USA number or go to lung.org. You can learn more there. But it's a great program that spans over several months. You start the program before you've even made that quit date in mind, so that you're geared up and ready to be successful. It's a tried and true program. But on the flip side, kids are going back to school, so there's two things that come to mind for me right away. First is our ad campaign that's in partnership with the Ad Council. It's Do the Vape Talk. So
I was going to ask about if you guys had taken on vaping.
Yeah, so, we're adults here. Do the Vape Talk sounds like something I'll talk we might have had, right?
Yeah.
So it's really a great platform for parents to know how to have that conversation about vaping before someone else does.
Sure.
And then resources around that. So there's resources for parents, there's toolkits for youth, and then our schools as well. So we've got a lot of incredible resources for middle school, high school, whether they're trying to get in front of and educate students, or we've looking for an alternative perhaps to some students who might be looking at a fine or suspension, a better way to approach that for them.
I was going to ask, you guys are probably taking the vaping on head on, haven't you?
Yeah, and we've continued to redo our programs, right? So when they first rolled out a few years ago, the pandemic happened. So how do we take those virtual? How do we keep things updated for parents? Especially when schools opened back up last year, right? We listened to what they needed, so we continue to update that. And then we use our partnerships like the Ad Council to bring awareness around it. So it's kind of like you might see some, it looks like a parent's head's in the clouds, right? And so we drive them to that toolkit. It's a conversation starter, helps them, what takes them through it, but also what does a vape pen look like, right? They're meant to not look like a vape pen noise. And I once was a high school age kiddo who probably tried to get something past mom or dad or another guardian in the household. And so this is a way just to support them and how to have a constructive conversation and resources that are there for them if they should need them.
Are you in schools? Do you do school type programs?
A lot of our programs are kind of what I would call like a train the trainer program. And that's why I really love them. It allows us to maximize our donations, and people trust those that they already know the best. So we like to bring people through our facilitator training programs. So in the schools, it's already a trusted person from the school that can come in and be a facilitator. That could be a parent, it could be a school employee, it might be a nurse, it might be a health teacher. It's really every group in there that could come in. And then the same through some of our other programs. School is back in session for many.
Today's a big day.
Yeah, today's a big day too. So even our back to school asthma programs, a lot of our education around that, or facilitator training, it's a great chance for them to come get more information, so parents are ready, so schools are ready.
So a lot of misnomers about national organizations like yourself. I worked for one for a long time, and the first thing people say is, I didn't know you were in Michigan. So, talk a little bit about that, and then talk a little bit about your Michigan presence, because you are right here in Southeast Michigan. You're in Oakland County, which is great to have a resources such as yourselves available to all of us. So explain how that works.
Yeah, and I do think people, for many years, they want to see it in their backyard, right? So they want to see a lot of offices, and for National Org, that looks a little different for us. So we have some staff that are based in our office in Oakland County, and then we've got some staff that are based remotely. And so we're here to serve wherever we're at.
Because you cover the entire state.
The whole state, yeah. So there's not a state that can't benefit from our work. And as a national org, that allows us to take those funds and complement what's in the community, to see what lung diseases are more prevalent from state to state, what programs already exist, so that we're maximizing how we spend our dollars. So step one is always, often our programs are facilitated by health departments, by schools, by health systems. All kinds of organizations come and help us facilitate those programs. So that way we can spread our reach out even more and people have access to our information.
And you still have this localized presence where you're you're forming partnerships, you're making connections that only helps us fund this mission further.
Yeah, it really helps us maximize the donor dollar for us. It's really important. We for over the last several years have been between 86 cents and 90 cents. That's where we sit right now, the dollar.
For those not familiar, in the nonprofit world, that's outstanding percentage of usage of donor dollars.
It is incredible. And one of the reasons, too, I love it is like when we are working in our communities alongside those that have a personal connection to lung disease and they want to fundraise for us, that they know that those dollars that they're asking for are going to the mission. And so their involvement in our work is a way for them to, either do something when they didn't know what to do, or do it in memory or honor, or maybe they're a company that's, getting involved and they want to be with a relevant, mission. How many of their employees might know a loved one or be impacted by lung disease or COVID-19. So we're there and we're relevant, and they're a brand that they know they can align with and feel comfortable doing work with us because we're nationwide, but they also get to see us here in the community.
You have your smiling faces. And I think that's something that we take away from the last couple of years in the pandemic was, so many people have some of these long hauling COVID symptoms that are affecting their respiratory system, their ability to breathe. And I always say, you can do a lot of things. And if you can't breathe, that impacts everything. And so you also probably have changed the resources and services that you provide based on some of post-COVID learnings.
Yeah. So, right, everybody had to go virtual. Everything has, and now it's neat to see, like many orgs, we've got a hybrid approach, right? So we've got some of our in-person trainings, but now with going virtual, what I love about that is it's super important to our organization as well, but to me personally is that access and equitable for everybody. So we do know that we have individuals across Michigan who might not be near a health center or want to do an in-person program. Well, now they've got a community online they can easily access. So whether that's a formal Better Breathers Club meeting or they're going to hop onto our Inspire communities and just connect with others with the lung disease and know that they're on a safe platform, that they've got access to information. And you touched on that long COVID, that long haulers piece.
Yeah.
So we have a lot of work around that, so we're funding research to continue to understand that, but also just to know that you're not alone, and it can be an isolating disease. So they can go online and find somebody else. They can call us and ask some questions, because sometimes I bet individuals, right, we're somewhat tired of COVID. We've all had that strain, and maybe they don't feel comfortable just sharing that with everybody, or they don't always know if they should bring it up to their doctor. A lot of times when it comes to healthcare, right, it's getting past that hurdle of just being brave enough to talk to your doctor about any lung thing going on. And so hopefully now we've got, some questionnaires, we've got some speaking points, we've got a couple bullet points, if you're experiencing this, right? So often you can say, well, I was online at the Lung Association, a trusted source, and I'd like to talk with you about X, Y, or Z, right? So it helps them get past that barrier. We need to still advocate for ourselves. We see that with lung cancer.
Absolutely.
It's a big reason why our community is impacted is they're not getting screening for those that are high risk. So that is why some of the work that we do is to help to educate providers, to educate our community, that we're here for them as support.
And you know this, I've told you this before. My father passed away from lung cancer 8 years ago. And leading up to his diagnosis, he just thought he was getting older, right?
Mm-hmm.
He was getting older, having trouble breathing. Like, we don't know how long he hadn't been feeling good because he probably didn't speak up, right?
Yeah.
Until my mother made him go see a doctor. But he's not the only one in that position too. And lung cancer is, if I'm not mistaken, it's one of the leading causes of cancer in adults.
Yeah, it is the number one cancer death.
There we go.
For men and women. And it's a shocking statistic when you think of it that way. So it's just not either on our radar. First of all,
one of the least funded cancers too.
Yes.
Research cancers.
Yeah.
Research dollars.
Yeah. And I think it's the funding research, whether that's through our work at the Lung Association or our work that we advocate through federal funded programs, right? It's really around that. It's understanding the disease. It's understanding how to treat it.
And it's understanding that it's not just because somebody smoked.
Yeah.
How often do you hear about folks that, have lung cancer that have never been around smoking in their life?
Yeah. And that's a stigma right there.
Yeah.
And even if you did, so what? You don't
Right.
deserve it. And I think for us, we're trying to really get rid of that stigma around it.
I appreciate that.
Yeah. We don't see that with other diseases very often. And we don't want that to be a reason why somebody didn't seek help because they thought they might be deserving or it's too late.
Right.
And we know with screening, you can improve your survivorship to over 60% if you're screened early on. So we know that that's a key for us is to get those at high risk to get screened so we can get them in a good treatment, that they have options, they have great quality of life.
Treatment's come a long way.
Oh, it's come in an incredible way. And that's one of my favorite parts of the role. I think all lung disease, our community, when we see advances in their disease and that they're doing well, they feel good. When we've got survivors that are racking up years that didn't think that would be hope for them, we've got that.
Those are the best.
Yeah.
Those are the best stories. Keeps you going from day to day.
It does. And it makes you hear that, but you're like, we want that for everybody. So I think that's what drives my work, is that I want that to be the outcome for everybody who receives a diagnosis or gets in front of one and is preventing lung disease. And so it's like, that's why I do what I do, is because I want to change that journey.
Passion is so apparent. Like, I love it. And you have lots of projects going on right now.
We do.
Well, you do something all year long.
Yes.
So, you're never stagnant. So, talk about the event coming up really soon, and then we'll talk about some of the other events that you do all year long.
Oh, that'd be great. Yeah. So always something happening, like you said. One of our signature events that is coming up, it's one of our annual events. It's called the Lung Force Walk. So again, focused on lung cancer and lung disease. Chance to bring our community together. I really say it's our lung communities event. So it's a chance for them to gather. We've been hosting it for a number of years now at the Detroit Zoo. So we're coming up on this year's date, which is Sunday, October 2nd. So we are
back in person.
I know.
It's so exciting.
So good. We were back last year, had a few hundred people come out. And what I say is, like, it rained and it was raining when people would have had to make a decision when they got out of bed, and they still came.
See?
So it tells us how important it is to safely gather at an outside venue. And they get to private experience at the zoo before it opens to the public. They're welcome to stay after. So very family forward event, but still great for companies to come out. Families that have a loved one or they themselves that are touched by lung disease or lung cancer. This is their event. So they get a chance to come learn about the work that we're doing, what we've got going on in the community, to meet some of our incredible partners, and have a great day at the zoo.
How does somebody register for it?
Super easy. Head to lungforce.org, look up the Detroit event, go ahead and register. Online, it's free. We'll take you through that process, get you all set up. When in doubt, just go to 1-800-LUNG-USA, give us a call. They'll forward you over. So any of our websites will direct anybody there. And that's the great thing. They can come out, they get signed up. So then they get what's happening, what to expect, how to get others involved, what's going to be going on that day. They can't join us in person that day. Maybe it's a conflict or they're not comfortable yet. We know with COVID, we've always got alternatives available. So we do offer a virtual option to be part of the day. It's something that we've really incorporated into all of our events to make sure that there are components for those that can't or aren't comfortable, that they can still be part of our movement.
So no excuse not to sign up.
Exactly.
You can walk anywhere and be a part of the Lung Force Walk.
Absolutely.
So one of your other events that's huge, and what I will probably never do, but I have good friends that do it every year, is your stair climb.
Yes, yeah.
How many stairs are in Comerica Park?
Oh gosh, we covered, I think last year's one of our routes was well over 1,600. So it kind of varies. Our routes vary from year to year. So it is... for most of our climbers, they are doing the entire lower bowl from, kind of that first section all the way around to the end cap. So our stair climb event, right, it takes some stairs, a fun challenge. But for us, it seems hard, but, we're there to support each other. You can stop and take breaks. The great thing about being in a stadium is you're going up and down, so you kind of get to recover a little bit in between, but your calves are feeling it more the next day.
I would imagine.
But, I think being there too kind of, it gives you, again, another behind the scenes private experience. So something special, something really motivating. The energy is always incredible. And I think the energy is always great at both of our events, but it's always just a little different. But there's definitely that positive, like you hear that buzzing, that energy from
Something's
everybody.
Something's going on that you want to be a part of.
Yeah.
At the stair climb, though, you have good partnerships with local fire departments. Kind of their event, and they carry their gear, don't they, when they run?
They wear their full gear, so that can be 60 or 70 pounds, which is crazy to me. Yeah, and they take it very competitively, so we have hundreds that show up. So I think on average between 45 and 60 departments from across Michigan. We usually pick up a couple Northern Ohio folks too that like to join us, but it's a tradition for them. So this is one of those, probably like conferences or other trainings. They look forward to seeing each other every year. So there's a fun, friendly competition between them, and they're coming out too for a good cause. Many of them are impacted by lung disease, and we know many firefighters are also first responders, so they're the first ones on scene when somebody is also having another lung emergency, a breathing emergency.
Probably the safest event you do all year long, because you have all these first responders there.
It is. It's amazing, right? It's always, they push it. Our first year going outside, we did have a heat wave. But I was like, well, if it was going to happen, I'm glad that we have professionals all around us. But
if I'm not mistaken, our Sterling Heights Fire Department, they proudly represent us there and do a great job. They sure
do. Yeah. So they have had a number of years of claiming both our fastest teams and our top fundraising.
So the target's on their back.
There's a couple communities that have a fun challenge. John Farah, who is one of their members, is our top fundraising firefighter from this past May's event. So
yeah, he's a pretty good one. He got money from me.
Well, thank you. Yeah. And so it's one of those. He'll joke. We've got some gentlemen there that are always training for the fastest, and then we've got some that are doing it, but he'll say that, and I was like, his time is pretty good, but it's been great this year. A lot of families from Sterling Heights actually were on site volunteering on the route, which was a blast, and we were so thankful to have their support. Our events could not happen without volunteers, and so it was so cool to give them that kind of behind the scene, because prior to going to stadium, you couldn't see them climbing the stairwell.
Because it was in tall building. You had, were you in the Rensen for a long time?
We were Rensen, and then a couple other skyscrapers downtown, so you can't see them. And
now
so
you can have a cheering section.
Yeah. We like this past year, we opened up the Pepsi porch so you could watch the entire day. So that was some of the things that we were able to realize and do safely if people wanted. So I know that was a huge attraction. I have spectators come in this year and get to see the action. Climbers come early who are maybe climbing later in the days. We'll say civilians get to watch the firefighters. So it's another great one of our community events. It's a great way to get out there, and we love working with the fire departments. I think they bring the fun, and I think they
So I'll throw
challenge
this
others.
out there publicly, and John can yell at me later, is that he would be happy for someone to take over his highest fundraising title because, it's that good, healthy competition for a good cause.
Agreed. I think he
Or he
feels
just
the
needs to up
same.
his game next year.
There's a couple
Are they
men
getting
and
close?
women who went back and forth. So we kind of reset with our new fiscal year. So John's going to have to work for that.
Johnny will have to up his game.
Mm-hmm. Yes.
So what, we have listeners out there that are probably wondering, A, how can they get involved? Maybe a walk's not for them. Maybe, they're not able to be physically active.
Yeah.
What are some other ways that folks, you mentioned volunteers, but what are other things throughout the community that people can get involved with?
Yeah. I think, volunteering in a number of ways at our events. You don't have to, we talked about walking and climbing stairs.
Right.
We have volunteers that are maybe coming in their rascals or coming with their scooters or walkers. They might be on oxygen and not feel comfortable, but we've got a spot for you, whether it's at an event or in our office helping us, gear up for an event or special activity in the community. But just to advocate. So first and foremost, be an advocate for us, especially around issues that are, around lung health. We live in Michigan, so whether we're advocating at state or we're at federal, sharing your story and telling people why it's important that we fund research, why clean air is important to you, while having, access to oral chemotherapy might be important to a loved one, So by going to lung.org, you can learn more about how to be an advocate right from home, share your story, but get involved and look through our programs and services. If there's something you have a personal passion, reach out to us. We'll help match you up with that right opportunity.
Their team is fantastic. If you say, I want to help, they are going to find a place for you
Absolutely.
within the organization. And it could just be, as easy as sharing some of your message on social media, because you guys you have a localized social media page for all things going on in Michigan with the American Lung Association. And it's a great way for people to stay connected and to learn more as well.
Yeah. And I think, too, we don't want to be a secret. Like
No.
many nonprofits, we're not trying to
You're
be out
here.
there. But, we spend our marketing dollars wisely. So, you'll often hear us when it talks about like screening and things of that nature. But sometimes people don't know about all the other things we talked about today. And so by people just sharing, like you said, on social media, reaching out, telling a friend about us,
Right.
When they know someone, hey, you should give the Lung Association a call, right? Just be our advocate and know that we're here, spread our work. Don't have to memorize everything we do. I've been here almost 5 years. I am still learning every day, even things that have been around for years. So just know that we're here. When you don't know who to go to for lung health information, start with us. Let us help you. Let's, be a service, be a guide. We've got, nurses and respiratory therapists on staff that are far more qualified than I am to speak to medical things and can help,
It's amazing
people
though
get
what
there.
you learn, what you've picked up probably
Yeah,
in your 5 years.
Exactly. Having a passion helps.
So you are wearing teal. I know it is not a coincidence.
Yes.
So talk a little bit about what that teal is the color
Yeah.
for lung cancer.
It's like the teal turquoise
Yes.
color. So that's a signature color of ours for lung force movement. So we picked a color that like stood out for us. So really having that color, just like many campaigns, it gives us a chance to start a conversation. But that really raises awareness around lung cancer and lung disease. So that starts in May. We do a turquoise takeover across the nation, both locally and nationally. So you'll see us on maybe ringing the stock exchange bell. Newscasters will be wearing it. You'll see some events. Communities often will go turquoise. It's a chance to raise awareness. First and foremost, like we talked about, sometimes individuals feel alone with lung disease. They don't know to reach out. Lung cancer may not be on our radar. So we hope to just change that, just to be knowing that we're here, that people are getting the screenings that they need and services, and that there's a community for them to be a part of. So I think most importantly, to know that we're here, to come reach out when you need help, or to know that we're here to walk alongside, climb stairs, to volunteer, whatever the case might be.
Maureen, thank you so much for being here, helping us raise awareness, helping us know what's out there in our community. I'm sure that anyone that is interested in volunteering, participating in an event, Maureen will take you up on it.
Would love to have them.
So thank you so much. Appreciate you being here, sharing so much insightful information and how we can all impact the air that we breathe and our lung health. So thank you again, and we look forward to you joining us on our next edition of the Chamber Connection. Thanks for tuning in to the Chamber Connection. Be sure to check out information on the Sterling Heights Regional Chamber of Commerce website, our Facebook page, Instagram, and LinkedIn. We look forward to you connecting with us and tuning in next time.